Hi, and welcome to my presentation. My name is Gutama. Today, the topic that I'll be covering is called Depression, Know the Signs. I would like to start by honoring the land that we are on, which has been the site of human activity since time immemorial. It is the traditional territories of the Huron-Wendat, Anishinaabe, the Chippewa, and the Haudenosaunee Confederacy, and more recently, the Mississaugas of the Credit Rivers First Nations. Ontario is covered by 46 treaties and other agreements, and is home to many Indigenous nations from across Turtle Island, including the Inuit and the Métis. These treaties and other agreements too peacefully share and care for the land and its resources. Other Indigenous nations, Europeans, and newcomers were invited into this covenant in the spirit of respect, peace, and friendship. We are all treaty people. Many of us have come here as settlers, immigrants, newcomers in this generation or generations past. We are mindful of broken covenants, and we strive to make this right with the land and with each other. I would also like to acknowledge those of us who came here forcibly and involuntarily, particularly as a result of transatlantic slave trade. And so I honor and pay tribute to the ancestors of African origin and descent. Why does land acknowledgement matter? Well, we are paying respect to a tradition that Indigenous people have been practicing for centuries, and land acknowledgement is an act of reconciliation. My agenda for my PowerPoint is, I hope, is that you'll be able to take away some key points on how you feel one step at a time. By doing this, it will enhance your comprehension to set new goals and make improvement. The presentation is for you to understand what is depression. So my goal is to help people learn the sign and symptoms of depression. So before I start, let us take a moment to check in with ourselves. Ask yourself the question, how am I doing? Be as objectively as possible. So just take a few seconds and just tap into yourself and see how you feel. Thank you. So I like this quote, so I'm just going to read this for you. If you know someone who's depressed, please resolve never to ask them why. Depression isn't a straightforward response to a bad situation. Depression just is, like the weather, by Stephen Fry. There has been ongoing concern that the pandemic has affected the mental health of Canadians, particularly those who have experienced impacts of pandemics such as social isolation, job loss, or changes in relationship. Changes in behaviors, thoughts, and feelings can be normal response to stressful situations, and experiencing symptoms consistent with one or more mental health condition does not always indicate a disorder. Nevertheless, such symptoms can undermine individuals' well-being and quality of life and may create a need for mental health supports. Early research surveys and from our own personal experience have shined a light that the COVID pandemic has affected mental health of Canadians. It has caused people to experience a great deal of social isolation, job loss, loss of relationships, and more introspective on their happiness and lives. Changes in behaviors, thoughts, and feelings can be a normal response to stressful situations, and experiencing symptoms consistent with one or more mental health conditions does not always indicate disorder. In hindsight, any one symptom can affect a person's overall well-being and quality of life. It can increase the likelihood of a person to seek further mental health supports. Depression is also known as a clinical or major depression. It is a mood disorder. It can look quite different from person to person. Please remember, people who have depression can't just snap out of it or make it go away. 1 in 4, 35% of Canadians 18 and older, according to Statistics Canada, they found that the higher proportion of young adults screened positive for depression between the fall 2020 and the spring of 2021 during the COVID pandemic. Depression will affect 1 in 8 Canadians at some point in their lives. Depression can affect anyone. Certain groups are more at risk, like for example, youth, seniors, women, people with chronic illness, people with substance use problems, and people from different cultures. Depression can be triggered by a life event, like a loss of a job, end of a relationship, loss of loved ones, meeting deadlines, financial problems, having a baby, other situations like family history. Having a family member who has depression may increase a person's risk. Imbalance of certain chemicals in their brain may lead to depression as well. Life changes such as major illness, such as a heart attack, stroke, or cancer may trigger depression as well. And there's more, but I just can't name everything else. Remember, depression can also occur for no apparent reason. What is a depressive order? It is an illness that involves the body, mood, and thoughts. It affects the way a person eats and sleeps, the way one feels about oneself, and their outlook on life. Without treatment, symptoms can last a week or years. Depression is not a passing the blue mood or a sign of personal weakness or a condition that can be willed or washed away. Symptoms of depression in no particular order. Feeling helpless or hopeless can make it difficult to cope, but it can also be a sign of mental health condition. Hopelessness is the feeling of being stuck. Poor concentration. This is when you have an increased inability to concentrate or think clearly. Anhedonia is defined as the inability to experience pleasure from activities usually found enjoyable. Example, exercise, hobbies, sexual activities, or social interactions. Sleep disturbance, whether it's the inability to go to sleep or maintaining sleep. Appetite disturbance will cause a person to lose weight. In some small subgroup of people, they will experience significant weight gain. Depression in women, 5 things you should know. It's more common in women. Depression increases the likelihood of suicide attempts. Women are 2 to 3 times more often than men to commit suicide. Number 3 is postpartum depression affects around 15% of women and is experienced after giving birth and for up to 1 year after. The prenatal period is the time during pregnancy and the first year after the birth of a child. In Ontario, suicide is the 4th leading cause of death in the prenatal period. 1 in 19 deaths of women during this period were due to suicide. Number 4, eating disorders or body images are usually triggered by the media or social media, the loss of interest in usual activities, social isolation, insomnia, loss of energy or problems concentrating, and weight loss or gain. It may not show itself solely, but tearfulness or sadness are also other signs. Number 5 is domestic violence and sexual abuse or childhood sexual abuse. This is where victimization of adulthood and childhood will leave trauma in the body. This means that there is a disruption and disconnection in their psychological and emotional well-being. It affects their relationships and work roles in their community. In men. Men are 3 times more likely to take their own lives than females. 8 men die of suicide in Canada every day. Most common methods tend to be overdosing, firearms, or hanging. The suicide rate grows more shocking among certain male subgroups, particularly those who are indigenous, homosexual, transgendered, in the military, middle age, or going through divorce, according to peer-reviewed research by Ogrodzinczuk, John Olive, and David Kelly and others. Depression, number 2, depression is associated with an increased risk of coronary heart disease in both genders, but men suffer at a higher death rate. Number 3, typically expressed as irritability, anger, and discouragement, may be difficult to recognize in men. It is often maxed by, number 4, is often maxed by alcohol or drugs, working excessively long hours, or being involved in inappropriate sexual relationships. Types of depression. There's major depression. It includes being suddenly or possibly triggered by a loss in crisis or change. It interferes with your normal everyday living. You're feeling sad or anxious at times is a normal part of life, but if these feelings last more than 2 weeks, they could be symptoms of major depression. Whereas if it continues of months and years, then this is major depression. Possible for a person to have only one episode of major depression. It's more common for episodes to be long-lasting, to occur several times in a person's life. So once again, major depression needs to continue for months or years. Bipolar disorder. People who are diagnosed as being bipolar will experience a depressive state before experiencing the manic and hypomanic mood episodes. Dysthymia. People with this illness are mildly depressed for years. They function fairly well on a daily basis, but their relationships suffer over time. Seasonal affective disorder. This is depression that results from changes in the season. Most cases begin in the fall or winter, or when there's a decrease in sunlight. Some refer this as the winter blues. And we spoke about postpartum depression in the previous slides. Professional treatment is necessary for all types of depression. Please remember that key point. Treatment for depression. Light therapy works best for people who are experiencing seasonal affective disorder. Then there's medication. So for example, antidepressants can help ease the symptom of depression and return to a person's normal functioning. However, one needs to be self-aware of the side effect of taking antidepressants. According to the Mayo Clinic, these side effects include nausea, weight gain, sleep problems, dry mouth, constipation, dizziness, agitation, restlessness, anxiety, sexual side effects, heart-related effects, and immune suppression, just to name a few. Psychotherapy. This can help many depressed people understand themselves and cope with their problems. For example, interpersonal therapy works to change relationships that affect depression, or CBT, called cognitive behavioral therapy, helps people change negative thinking and behavior patterns. Electroconvulsive therapy, ECT, is electrical shock therapy treatment for drug-resistant depression. It is used in patients with severe major depression or bipolar disorder who have not responded well to antidepressants. Exercise, any form of physical activity, can help with producing feel-good hormones. Herbal therapy, example, ginseng is used to boost brain function in people usually drinking in tea, or ginkgo biloba helps patients who have dementia or mental difficulties. There's also St. John's wort is an herbal medicine that helps to reduce depression. Other things you can do to help with depression is eat a proper, well-balanced diet, obtain an adequate amount of sleep, reduce or eliminate the use of alcohol or drugs, reduce or eliminate the use of social media platforms, join clubs to prevent from being socially isolated, volunteer in your community, and seek therapy. Remember this, there's hope, even when your brain tells you there isn't, by John Green. And this comes to the conclusion of my PowerPoint presentation. The one thing I'd like to take away from this presentation is that healing takes time. So thank you for listening, and I hope you have a great day. Take care.